It's really important, but often gets crowded out in discussions about treatments, and that is how we determine effectiveness of our treatments and some of the challenges that are currently sort of going on around that area. Feel free at the Q&A to tell me I'm wrong about anything. I'm quite happy to be wrong about things. I'm going to start just by going through my declarations of interest. This is something that's usually rushed, but actually, when we talk about effectiveness evidence, if you think about it, we're all vested, powerfully vested. We all have these interests, so it's important to go through them. So I'm a lecturer in physiotherapy at Brunel University, and that's where I draw my salary. I'm a senior editor for Body in Mind, the blog. Put your hand up if you read Body in Mind. Don't be polite if you don't. For those of you who don't have your hand up, go on, read Body in Mind. I'm on the editorial board of the Cochrane Pain Palliative and Supportive Care Group. I worked recently with NICE, the clinical guidelines producer in the UK, on the recent guideline for low back pain, which you may have seen. And I've received speakers' fees over the years from all of these organisations, and I receive payment from time to time for running workshops that help clinicians work out how better to read a paper. So they're my interests. So let's get into the meat of the topic now. Sometimes I think to myself, why do I even need to think about evidence? Because, you know, all I have to do is consult Google to realize that persistent pain has already been cured, and it's already been cured about 1,000 times, right? I think my favorite one of these is this one here. This is a subliminal CD. I imagine these days you can just download it from iTunes, and you plug it in and you go to sleep, and when you wake up, your back pain is cured. It's fantastic, right? So there's so much hope out there. But imagine being the person with persistent pain who's trying to find answers. So you start to Google and you find these things, the back knobber, the fibromyalgia cure in just 3 easy steps. I must have wasted a lot of time in my career. The 7-day back pain cure. How do you make sense of that? Claim and counterclaim. But the thing about that is, this industry isn't an industry filled full of people with bad intentions, filled full of charlatans. It's an industry filled with people who all have the best intentions. Well, maybe not all, but I think most of us have the best intentions. We passionately believe in the training that we've had. We passionately feel that we are seeing improvement in our patients and that we are driving that change. And it's probably best summed up by this quote from the medical philosopher and biologist from years ago, Sir Peter Medawar, which is that the exaggerated claims for the effectiveness of a treatment are usually the outcome of a kindly conspiracy in which everybody has the best intentions.